It's amazing when you think about it, how closely linked human health and animal health really are.
Oh, absolutely.
The COVID-19 pandemic, I think, really brought that home for a lot of us.
Yeah, it really highlighted that interconnectedness.
Yeah, for sure. And today, we're going to be looking at a really important development here in India, sort of the efforts to strengthen wildlife health surveillance,
Mm.
to get ahead of those diseases that can potentially jump from animals to humans.
Yes, a very critical area, especially as we see these zoonotic diseases on the rise globally.
Exactly, exactly. And, for those of you out there, especially if you're following current affairs, keeping an eye on things like the UPSC exams, this is definitely an area that, is worth paying close attention to.
It is, it is. And I think as we dive into this a bit deeper, we'll see how proactive India is being in addressing this, which really speaks to the national priorities, both in terms of public health and environmental management.
Yeah, absolutely. So what we've been looking at are some recent reports, primarily from the Indian Express, and also some information coming directly from the Press Information Bureau, the PIB.
Right.
And we're focusing on the National Wildlife Health Policy and this newly established National Referral Centre for Wildlife.
Yes, exciting developments.
Yeah, definitely, definitely. So our goal today is to really unpack that, to understand the core strategy India is putting into place to tackle these zoonotic threats, these threats coming from wildlife. And it's crucial information, for all of us, I think, to be aware of as these developments are happening. So let's jump right in. Why is this such a big focus right now? Why this emphasis on wildlife health surveillance?
Well, I think if we look at the global context, the numbers really tell the story. About 60%, roughly 60% of all emerging infectious diseases worldwide are zoonotic, meaning they can transmit between animals and humans. And then of those, a huge proportion, about 72%, are believed to originate in wildlife. So, that right there just highlights the sheer scale of the risk we're dealing with.
Yeah. Those are striking figures for sure. I mean, it really underscores that this is not some kind of fringe concern. This is a major issue.
Exactly. And it's not just a global phenomenon. We've seen this play out here in India as well.
Right.
We've had instances of Cassandra forest disease, the Nipah virus outbreaks.
Yeah.
And those were localized, but they demonstrated very clearly the potential consequences, when these diseases cross over from wildlife to the human population.
Yeah, absolutely. And I think, even those localized outbreaks, as you said, can have a huge impact, right, on communities, on regional economies.
Oh, absolutely.
And so this isn't just about preventing, a future global pandemic. This is also about safeguarding public health right now at a very local level.
Exactly, exactly. And the scope of this isn't limited to wild animals in their natural habitats. There's also, a need to keep a close eye on captive wild animals.
Right.
Those that are in zoological institutions around the country.
Yeah.
They can also be susceptible to diseases, and there's always that potential for spillover.
Makes sense. Makes sense. So with all of this, this kind of backdrop of potential risks, past experiences, India has now established the National Referral Centre for Wildlife, or NRC-W.
Yeah.
Can you tell us more about that, what this center is all about?
Well, the NRC-W, it's located in Junagadh, Gujarat, and it's a really significant development.
Okay.
The Central Zoo Authority, the CZA, under the Union Environment Ministry, they've been really instrumental in this, taking the lead in preparing the blueprints for this center, how it's going to be developed, how it's going to operate.
So what will be its main areas of focus? What will it do specifically?
So the key focus areas are really going to be on emerging infectious diseases, making sure we can detect them and manage them effectively, comprehensive wildlife disease surveillance programs, and, coordinating a proper response to any outbreaks that might occur.
Yeah.
Given that, globally we're seeing this trend of zoonotic diseases, emerging and reemerging, this center is really designed to be a cornerstone of our national defense against such threats.
Yeah, it's pretty sobering when you think about the numbers you mentioned earlier.
Yeah, big.
That out of over 1,400 known pathogens that can affect humans, 816 of them are zoonotic.
Huge number, yeah.
Yeah, it's more than half.
Yeah.
So that really highlights the sheer scale of the potential risks we need to be prepared for.
Absolutely.
And so this NRC-W is going to be this dedicated hub to tackle that, essentially. What are its main objectives in doing so?
Well, the core objectives are to significantly strengthen our ability to detect diseases early on in wildlife, to advance research into these diseases, and to establish really robust protocols for the safe handling of animals. that last point is really critical because it directly contributes to preventing those initial spillover events, where a pathogen jumps from wildlife to humans.
So it's not just about reacting after an outbreak happens. It's about trying to get ahead of it, understanding those threats before they potentially become a problem.
Exactly.
What kind of advanced technologies and capabilities will this NRC-W be employing to do that?
They're going to be equipped with really cutting-edge investigation and surveillance technologies.
Okay.
This is going to enable them to do really sophisticated detection of diseases, both in animal populations and, crucially, also in human populations in the event of a spillover. Beyond technology, they'll also play a vital role in providing specialized skills-based training for people working in this field.
Right.
There'll be a center for in-depth data analytics to really try to identify those emerging trends and patterns in wildlife diseases. And, of course, contributing to the development of policies, evidence-based policies to improve our management of wildlife health overall.
So it sounds like a very holistic approach.
Yeah.
Covering everything from the scientific tools to the human expertise.
Yeah, absolutely.
And I understand that the NRC-W will be operating under this One Health framework.
Yes.
Can you explain a little bit about what that is for our listeners who may not be familiar?
So the One Health approach, it's this globally recognized framework, and it really emphasizes that interconnectedness between human health, animal health, and environmental health. They're not separate. They're all linked. And the NRC-W is going to be actively working to foster that collaboration and communication between these different sectors. So bringing together expertise from wildlife health programs, human public health initiatives, animal husbandry and livestock management programs. That integrated perspective is really, really important for effectively preventing and managing zoonotic diseases.
Right, because those threats often emerge, as you said, at the interface of these different areas.
Exactly.
So who will the NRC-W be collaborating with to achieve this, to achieve its objectives?
Collaboration is really at the heart of their strategy.
Okay.
They'll be working closely with a whole range of national and international research institutions to boost our disease surveillance capabilities, conduct cutting-edge research into wildlife pathogens, and contribute to those broader wildlife conservation efforts.
Yeah.
The Central Zoo Authority, the CZA, will act as the nodal agency.
Okay.
So essentially, they'll be the central coordinating body for all these collaborations, making sure we have a cohesive national strategy, linking zoos and all these other wildlife health initiatives across India.
So that's the NRC-W, but there's also the National Wildlife Health Policy that's currently under review.
Yes.
How does that policy framework sort of complement the work of the NRC-W?
So the ongoing review of the National Wildlife Health Policy, or NWHP, it's happening at a really crucial time, especially given what we went through with the COVID-19 pandemic just 5 years ago, which, really underlined the global risks associated with these zoonotic diseases. And the draft policy, it sets out some key proposals, to strengthen our national preparedness and response.
What kind of key measures are being proposed?
Well, some of the key proposals include developing these integrated surveillance systems, to get a much more comprehensive and real-time understanding of wildlife health across the country. There's also an emphasis on setting up new and advanced diagnostic laboratories that can handle these specific challenges of identifying these pathogens in wildlife samples. And a really important point is that it advocates for this enhanced cross-sectoral collaboration, bringing together experts and resources and data from various government ministries and research bodies.
It sounds like the overall goal then is to really improve our ability to spot those potential threats coming from wildlife as early as possible, and then to mount a rapid and effective response when necessary.
Absolutely. The main aim is to mitigate the risks of these wildlife origin pathogens by, really bolstering our early warning systems and our capacity to respond quickly.
Yeah, and it's important to note, I think, as we talked about earlier, that alignment with the National One Health mission.
Yes.
So that sort of integrated approach is a key part of this as well.
Very much so.
And it seems like a crucial lesson, reinforced by what we've seen globally, is this need to monitor both wild and captive wildlife populations.
Oh, absolutely. Having that comprehensive monitoring is really seen as fundamental now for pandemic preparedness. Diseases can emerge in either setting and have the potential to spread. So we need robust surveillance in place for both to give us those early warnings.
So who's been involved in shaping this National Wildlife Health Policy? Who are the key players behind it?
The Central Zoo Authority, the CZA, who we mentioned earlier with the NRC-W, they're taking a leading role in actually drafting the policy. But it's a collaborative effort. They're getting input and guidance from the Office of the Principal Scientific Advisor to the Government of India, as well as technical support from IIT Bombay.
Right.
This kind of multi-stakeholder involvement is really key to make sure the policy is well-informed, scientifically sound, that it's robust.
And where does the NRC-W fit into all of this? It sounds like it's more than just a research institution.
You're right, it is. It's actually envisioned as this central authority within the policy framework. It'll be the primary institution for investigating those wildlife mortalities, diagnosing the causes of outbreaks, providing those advanced diagnostic and treatment capabilities. The fact that it was actually inaugurated by Prime Minister Modi in Junagadh just shows how important it is. It really has this strategic role in our national strategy for wildlife health management and preventing these zoonotic diseases.
And one of the challenges you mentioned earlier was this somewhat fragmented nature of wildlife disease surveillance.
Right.
How does the new policy, along with the NRC-W, aim to address that?
So currently, you're right, it is quite fragmented.
Yeah.
With different ministries and research initiatives often working in their own silos. The new policy is really trying to change that by pushing for much greater integration, especially between the Ministry of Environment, Forest, and Climate Change, the Ministry of Agriculture and Farmers' Welfare, and the Department of Animal Husbandry and Dairying. Better communication, data sharing between those entities is really, really important for building that more unified understanding of the disease landscape across the country.
So it's about connecting all the dots, essentially, to get that clearer picture.
Exactly.
And I understand there are also plans to improve our data infrastructure in this area.
Yes. A key part of the policy is this proposal to establish a national wildlife health database and a wildlife health information system.
Okay.
These centralized systems will house both real-time data and historical data, which will significantly improve our ability to track those disease trends, spot potential threats early, and provide a solid foundation for research and policy development. They'll also work with existing systems like the National Animal Disease Referral Expert System to create this more powerful and predictive framework for disease prevention and management.
That sounds like a huge step forward, using the power of data to safeguard public health.
It is.
What about expanding our reach on the ground, particularly in areas where those human-wildlife interactions are more frequent, where the risk of spillover might be higher?
That's a good point. The policy recognizes that, and it recommends setting up these satellite diagnostic laboratories near key forest areas and wildlife reserves to enable much quicker detection and response in those critical zones.
Yeah.
There's also a big emphasis on community engagement. For example, promoting vaccination programs for livestock in communities near national parks and sanctuaries. That helps to prevent spillover from domestic animals to wild populations, which benefits both conservation and the health of those local communities.
So it's a very comprehensive strategy, I think, addressing those different levels.
Yeah.
From national policy to the local communities on the ground.
It is. It is. The NRC-W and the strengthening of the NWHP, they really represent a proactive and significant step forward for India in terms of bolstering our defenses against these threats and building a more resilient system to protect both human and animal health.
Absolutely. And for all of you listening, especially those preparing for the UPSC Civil Services examination, understanding these developments, this is really crucial.
It is.
It touches on so many important aspects: governance, science, public well-being, things that are very relevant to the syllabus.
Absolutely. The interconnectedness of human, animal, and environmental health, the One Health approach, the role of technology, the need for interministerial coordination, these are all key themes that are very pertinent for the UPSC syllabus and for understanding how India is approaching these complex challenges.
So as we wrap up this deep dive, here's something to think about. Given that we're seeing more and more interactions between humans and wildlife, driven by things like habitat loss, how do you think India can best balance its conservation efforts with the need to ensure public health security against those zoonotic threats?
That is the big question, isn't it? And one that will continue to be at the forefront of policy and action.
Yeah, it's a tough one. But thank you so much for joining us for this deep dive. If you found this valuable and want to hear more, please like, subscribe to our channel, and leave a comment with any questions you might have.
We always love hearing from you.
Yes, we do. And for this deep dive, our primary sources were recent articles in the Indian Express and information released by the PIB, the Press Information Bureau. We encourage you to check those out for more details. Until our next deep dive, stay curious and stay informed.